Hi, I'm Preeti Patnaik, the founder of Geneva Health Files, which is an investigative journalistic initiative that seeks to capture power and politics in global health. We track international health policy as it unfolds in the capital of global health, Geneva, Switzerland. We use a comprehensive interdisciplinary approach in our reporting, one that combines perspectives from science, trade, economics, governance to look at global health issues more critically. We reach a niche and elite readership of policymakers, diplomats, academics, activists, and the private sector, essentially experts working in global health, through our newsletters that offer distinct curation and investigative analysis every week. Our mission is not only to bring diverse perspectives to the story of global health, but to also contribute towards greater accountability and transparency in global health by honest and rigorous reporting. The goal has been to increase public engagement in global health policymaking through journalism. The story of Geneva Health Files and how it came to be is something like this. I have been a journalist for 20 years and I've reported from New Delhi, New York, and in Geneva on finance, trade, and health. So while reporting on global health for the past 10 years in Geneva, I often found that crucial policy debates here had little space in mainstream media. I really wanted to examine and investigate the seemingly technical matters in global health and write for a specialized readership. I knew there would be demand. I started self-publishing in April 2020 just as COVID-19 was raging across the world. I simply had to go ahead and start telling these stories in the way I cared. So there was no time to waste persuading editors to read the writing on the wall, as it were. Global health was and is undergoing seismic changes, and I really wanted to document this in a systematic and a consistent manner. So the pandemic of COVID-19 became a personal inflection point that compelled me to become a publisher and a media entrepreneur. As a reporter, I was seized by the moment when I realized the historic importance of witnessing events at the absolute forefront of global health policy making. Years of working independently had honed my editorial decision-making, and I felt confident. And that is how Geneva Health Files was born. The pandemic drew the world's attention to Geneva. This relatively quiet Swiss city has been a dynamic ecosystem where private and public interests collide in the closed-door settings of international organizations away from media glare. Geneva is full of spaces where opaque negotiations are held. This city is home to more than 200 different organizations associated with the framing of international health policy. All countries have their permanent missions to the UN and WHO here. So there's a lot that's happening that deserves closer scrutiny. In the 4 years that we have been in operations, we have published more than 400 long-form investigative analysis. We have reported on the most important stories of pandemic-related policy making, in depth and in real time, and will continue to do so. If you work in global health, you cannot do without reading us. We have moved the needle on global health journalism. We are here to stay.